Manya Dr. Fauzia Khan ji, demand for national policy for consistent and effective support for children with learning disabilities.
Thank you, Deputy Chairman, sir. Sir, children with learning disabilities are not small in number in this nation. Although this momentous population of children with learning disabilities or intellectual disabilities face significant educational barriers and challenges, the national policy on education speaks very little about it. This is an area which doesn't deserve to be neglected, sir. And most developed countries in the world have minutely laid out policies for children with learning disabilities. In our country, despite their legal recognition under the Revised Persons with Disabilities Act 2016, enormous issues still remain. Major fundamental issues are, sir, lack of standardized and consistent assessment tools and diagnostic protocols that leads to imprecise data on the prevalence of learning disabilities. If correct data is received, the sheer numbers of these children could be absolutely astounding. No standardized school-level screening exists. Schools depend on teachers' observations and judgments for referrals. This often results in unidentified children who are mislabeled as slow learners, lazy, or having a bad attitude, and thus end up as dropouts and failures in life, sir, and this, sir, is criminal. Current diagnostic tools are either inadequate or ill-suited to the Indian environment. To address these challenges, there's a pressing need for early screening. But early screening, these schemes have limitations, sir. Strengthening learning environments and enhancing teacher sensitization and teacher training are vital steps. For training, screening, support, the existing infrastructure of ASHA and Anganwadi workers and teachers are vital steps. Sir, a clear referral policy could be made from ASHA and Anganwadi workers and teachers to specialized educators and clinical psychologists. This is important for clinical comprehensive diagnosis. Currently, the absence of a national policy on learning disabilities leads to varied state-level strategies, sir. A national policy would standardize identification, intervention, and support efforts nationwide. Professional recommendations and strategies that could be designed for schools are flexible teaching methods, individualized learning plans, multisensory techniques, assisted technologies like speech-to-text software, digital platforms for personalized learning, supportive classroom environments with positive reinforcement, peer support programs, and workshops for parents and on effective home support. If properly assisted, sir, these are the children who can show light to the world, like Albert Einstein, who was also recognized as